When we think about receiving health care, it's generally about going to a doctor's office, a hospital, a rehab center, an urgent care facility. But what about receiving care at home?
It may not be something that you've experienced, but for thousands of people, even millions of people across the country, home care has been the difference between staying in the home you love and having to live somewhere else.
That's right, home health care at home.
Absolutely.
As it should be. Here with more are David BAYADA, president of BAYADA Home Health Care, and Mandy Tilton, their chief nursing officer. Welcome.
Thank you both for being here.
Thanks for
So
having
David, why don't you tell us, how does home health care really help? I mean, it helps so many people.
Well, home health care is not something that's new. The house call is the original form of health care, and today, many people don't realize the amount of services they can receive at home, whether it's a child with complex needs, an adult that's been catastrophically injured or diagnosed, or a senior that's dealing with chronic illness. Home care is a great resource to help those that want to be cared for and be safe and independent in the place they love most.
Mandy, what do you do to ensure that clinicians, nurses are the highest calibers, where someone like Montel or me can feel like we're confident that you're coming in?
Absolutely. Well, as David described, we provide a variety of services. So we ensure our caregivers and clinicians are fine-tunedly prepared for the skills and the services they're going to deliver. We do this, for example, by training in our state-of-the-art simulation labs, where clinicians can learn new skills and practice them in a safe environment.
Well, David, I mean, your father founded this company, back in 1975? You've been around for a long time.
50 years.
Wow. So tell me a little bit about what the secret sauce is to having a person live a better life, like you say.
Well, unlike an institution, a hospital, a rehab facility, care in the home is one-on-one. And so the most important thing that makes us different and makes us who we are and has allowed us to be here for 50 years is the quality of the people in the home. Our team that represents BAYADA, the BAYADA nurse, the BAYADA social worker, the BAYADA home health aide, is really what makes us who we are.
You're obviously very passionate about what you're doing, and I see it. How would you say the home care is different from, let's say, from a facility or a hospital?
Well, my passion is also fueled by personal experience, where my family and I brought in clinicians and caregivers to help care for my grandparents so they could live in the place that they loved, their home. And I would say that we're uniquely able to do many of the things that nurses learn about in nursing school. We deliver one-on-one holistic care. We're able to implement the nursing process, where we create a plan, implement it, and watch progress. We're able to teach and provide education all the time. And it's not cliche to say that many of our clients and their families consider us part of their family as well.
And you said it earlier, I mean, you're helping everybody who has a child that's sick at home, say a young adult who may have been on the spectrum, or a young adult who is catastrophically injured, or even the elderly. But where can a person, when do they decide, where do I look, where do I start? How do I get started on this? Where do I go first?
Well, the first step often for many families is other families that have been through similar experiences. Many of us know a family or know someone that's been through this type of challenge in their life with their loved ones. And so friends and family is a great place to start, but then certainly your physician, social workers, care managers in the hospital are great resources for the availability of services that can help families in need.
Does the nursing shortage affect how you care for people?
Well, the nursing shortage and the caregiver shortage overall has impacted us. So we're constantly proactively looking for individuals who are compassionate and want to provide that one-on-one care in the home. We're at a bit of a disadvantage where many nursing programs don't teach about home care and what that looks like. So we use platforms just like this to share our message and create awareness.
Obviously, home is really the best place to be with family, especially when family is needed. For our viewers who'd like more information, David, where can our viewers go?
Well, whether you're a family looking to access home-based services or you're a clinician that's interested in a career, BAYADA.com, as well as our social channels, are a great place to start. Instagram, Facebook, LinkedIn, great resources for those that are looking to learn more.
Thank you both so much for being here with us today, okay? For sure. Look, and if you want more information, of course, you can go to our website, thebouncingact.com. We'll be back right after this.